And welcome to Williams Island TV. Today we're going to have a very interesting show because we have Dr. Rick Mars. We're not talking about dentistry per se. We're talking about how important health of the mouth is to your general health. As you can see, we have Arlene here today, who is really the boss of this show. She's the one that runs the whole thing. I do what I'm told with Arlene. I think Rick will be a great addition because it goes along with all the things that we're trying to do with health and fitness and preparation. Absolutely. But I want to talk a little about what's going on the island because there's so many rumors that go back and forth on the island. And, you know, it amazes me because do you get many calls?
I get a few calls and, you know, they're just wondering what's going on. And we do send out a weekly email that people should really watch out for. It's on Mondays. If there's anything going on in the island, the board meetings, any information about closures, construction, or anything along those lines is always in the Monday email. So that's one way of kind of nipping that in the bud so you can get your information.
And what channel is our show on?
It's on Hotwire channel 99.
99,
and we also have a community page on there. So on channel 99, there's not only the Island Insider, but you can get information about, you know, like our pet policy or any other videos that we might have going up.
Let me just go through a few things that we are doing now. The padel courts are in actual under construction as we speak. We've taken court one. As you can go, if you walk by it, you'll see the dirt's being dug up, the new foundation is being placed. And most likely that's going to be up and running in about 30 to 45 days from what I understand.
It was quick.
Yeah, it's already, once the ground is done, that will be put up. Today, we were looking at the new ground that's going in under the playground, and that's going to be starting very shortly. And I know there's been some comments about the health and safety of the children and what we're putting down on the ground. One of the reasons we're taking up the existing surface is because it's made of refabricated asphalt. There's some carcinogens in it. We decided it's not a safe environment for the kids, and we're putting in a specially treated AstroTurf, which is environmentally safe. It's safe for children. That's going to be starting very shortly, if not immediately. Then once the Island Club is finished, we will then put up the sports park and the sports court, which will go on our new triangle. There's been a lot of talk about, now that we did O'Lear, what's the next big project we do? Just so there's no misunderstanding, we intend to redo the grill. We're looking into the kitchen, the layout, the equipment, and new menus to go along with the needs that will do. But we will be redecorating and redesigning the entire restaurant. Now, it doesn't mean we're going to move the bar and change the layout, but will be new floors, new furnishings, new wall treatments, new everything. So it'll be a whole new and improved on a par with what we've done with O'Lear. We will then be doing the spa simultaneously. We want to enlarge some of the areas of usage. We want to get rid of some of the noise factors. We're going to redo the downstairs, new locker rooms, new areas down there for the women and the men's lounge areas. So it's going to be an amazing project. We look to start that sometime this spring, probably April, May, June of 26. It will take anywhere from 10 months to 12, 14 months to complete. We will have facilities for the spa while that's under construction. So there will never be a time we won't have a spa available to the residents. Because I know
that's very important.
The big question.
Yes.
But we are doing both at the same time. We will be redoing the entrance as you walk into the building. So that's why we want to do them both while we're doing this. So those are for real. They are going to be happening. And I know some people said, well, you know, you did the O'Lear. Why haven't you done something to the grill? It is getting done, and we are going to be doing it. We will be doing new landscaping around some of the areas on the island now that we're getting ready, but we want to wait till all the construction is done on it. We do know that there's some issues with Hotwire. If you let Arlene know, we will set up a town hall meeting for you in your buildings. Hotwire will come, hear your complaints, hear your problems, deal with them on a personalized level, and also make sure there's a crew full-time that will take care of your problems in your homes. We have special VIP numbers to call. We have people on site all the time to take care of your problems, but we have to know about them. Let Arlene know. Now, I guess you hear things, don't you?
Well, I did send out all the pertinent information, contact information for Hotwire. So if you do have any issues, there is a dedicated line and a dedicated email just for Williams Island. So you can, if you have an issue with what's already installed or you want to schedule an installation, the numbers are there, the emails are there. It's a 24/7 phone number The email is monitored weekly, like Monday through Friday from 9 to 5. But you can get a hold of them on the phone 24/7. So they do have dedicated people just for us.
Do you find that the buildings are getting the information they need? Because some people say they don't know about things till after it happens or whatever the case is.
Well, I send everything. I send the Monday email as well. I send everything to the building concierges. So they, if they're in doubt, the building concierges will call me, just make sure that all the information is correct. Or if they need some information that they haven't gotten, or they hear a rumor or something along those lines, I have very open communication with the building concierges. So chances are, if your building concierge doesn't know, she'll call me.
We also want to talk a little about the finances of the island. Just to bring you up to date, we are in very solid ground. We have the reserves that we have to have under state law. We have plenty of money in the bank. Our funds are soundly invested, earning money. All of these projects that we're talking about doing over the next 5 years, as you know, we're going to be spending $10-12 million in upgrading the island to make sure of the quality. None of this will be done through assessments. We have put together and planned accordingly with our financing and our budgets to make sure that we have the funding to do everything that we've talked about doing without $1 of assessment to the residents. And we thought that was very, very important because we don't want to burden you. We know some of the buildings are going through tremendous renovations, and some of those are pretty expensive. That's a little bit about what's going on the island. I can only tell you it's paradise here. I got the most beautiful letter from a woman who's on the C&E committee, coincidentally, but she wrote me saying every morning she wakes up, she walks around the island, and she said all she does is think about paradise and how wonderful it is to live here.
It is a little piece of paradise.
And we are a bubble. People don't realize this is not the real world. I mean, you literally never have to leave the island. You have this beautiful new pool area. You have the snack bar out there. You have a Lear. You have the grill. You have the spa. You have tennis. You have sports courts. I mean, what more can anyone ask for? So if you have problems, if there's issues, just let us know. There will always be someone to take care of anything you have. And that's mainly sitting here right now. Called Ali.
If I don't have the answer, I'll find the answer out.
She will. And she really is the boss because she puts all of this TV together. She makes sure it runs properly. She makes sure it gets out properly. And we're here for you. We are your eyes and ears, but we want you to ask when you have any kind of issues. And thank you. I want to thank you personally because you do an amazing job. She's one of the unsung heroes. We don't really see Arlene a lot because she doesn't like to be in front of the camera. But what she does for us is truly amazing. I thank you all so much, and we'll be right back. As I told you, we're going to have some very interesting conversations today, primarily about health. A very dear friend of mine, Dr. Rick Mars, is with me today, and we're not here to promote going to the dentist. We're really here to talk about how important dental hygiene is to brain health, heart health, and other health issues. I've known Dr. Mars as long as I can remember. I used to hear about him from his mom many years ago, how cute he was, how rambunctious he was.
Some things have changed.
We've served on the board of directors of Bettora together for many, many years. He's huge in the community. He does tremendous pro bono work and does charity work. He opens up his offices once a week or once a month for free care for people that can't afford it. But I thought he would be perfect to bring on today because he's been in the community for a long time and he knows the people, but more importantly, he's made a study of health issues, not just dental issues, but the relationship of the two. So rather than me tell you a little about Rick, Dr. Mars, how'd you get into dentistry?
So I am the prototypical hometown boy. I was literally born right down Biscayne Boulevard at what used to be North Miami General Hospital. You know, I was from that generation where your parents say, you have to do better than us. And we want you to be a doctor, we want you to be something of that nature, and I like working with my hands. So my childhood dentist, who happens to be a Williams Island resident, many of you may know Dr. Miles Cutler. He is my mentor. I went into his practice from my junior high and high school years and just looked over his shoulder and watched.
Really? So you weren't in practice, you weren't in college at that time? You were just learning.
Way before. Just look over my shoulder. I'll teach you some tricks. You'll pick some things up. And
I
then
didn't know that.
I went to high school, went back in, looked over his shoulder then. College came, same thing. On breaks, I'd come down, go to the office, stick my head in there. Dental school came, and then finally, I was getting ready to graduate. And I said, Miles, you've been telling me, promising me, for many years, you'll have a job for me. And actually, he met my father, believe it or not. If you're an old North Miami Beach person, you know this, on 163rd Street, something called Sam's Delicatessen. And they used to eat at the deli there together. And he promised my dad that he would have a job for me when I got out. Miles kept his promise to my dad, who passed away, unfortunately, in 1985. I got out of school in 1988, and that dental care group has been my home ever since. I started as an associate dentist there.
Now, Miles was there at that time.
Miles was
it was
there.
his practice, right?
He was there for a few years with Joel Glicksman and myself.
Right.
And unfortunately, Miles had a little accident, golf accident. He had to retire, and he turned the store over to me, if you will, the practice over to me. I've been running it with Joel for many, many years now. Now we're very successful. We have 4 offices. We've been voted by the readers of Miami Herald the last 2 years, the favorite dental office. Miami New Times voted us the best dental office. I was honored with Aventura's best dentist for last couple of years in a row. So we've really, kept a legacy that he built. He's very proud when he comes in. It's his baby that he put together. We've just grew it to something bigger and better thanks to, the groundwork that he laid for us.
Well, it's so interesting you mentioned Miles, because Miles on the island, he chairs the architectural committee, which no one would ever, but the man just loves to work.
Yep.
And his job is to ensure that everything that goes on the island complies with the architectural controls of the island, the city, etc. He runs the putting green for us. He has all these outings, these golf outings. I mean, it's amazing how involved Miles is on the island.
He's amazing. This day, we had lunch just outside here at the pool a couple of months ago, and Miles doesn't stop, thank God. Let him go keep kicking on for many years, thank God.
Let's talk about the relationship, because we did talk about this, and it's become so involved today, where the mouth is the breeding ground of so many germs, a bad tooth, a toothache, or an infection. It's right in the brain, it's in the heart. Tell me, how'd you get into more of that interrelationship? Because I know that's a big part of your study now.
So when I was in dental school, you basically learn that you get out, you fix teeth. That's what dentists do, they fix teeth. And as my journey has progressed in dentistry, it's become so much more. There's jokes, oh, you're a dentist, you're not a doctor. To a lot of people, we're their most important doctor, because we see things in the mouth before you see it in the rest of the body. I mean, when the whole AIDS crisis was going on, we would see lesions in the mouth that people didn't know they had, and we were diagnosing people with AIDS before they even know they had it. My own mother, unfortunately, who passed away, she had an oral cancer diagnosed in our office. Had no idea she had it. We see things like this on a regular basis in our office. Our team is trained. They look for all sorts of things going on in the mouth, abnormalities, things of that nature, and we oftentimes find things. We take blood pressures in our office. And a lot of people don't go to the doctor unless they have a lot of aches and pains.
Yeah.
And I won't tell you the stereotypical groups, but you know who you are out there who doesn't go to the doctor unless it's hurting them and you absolutely have to go. But they come to the dentist, and we'll take blood pressures. We do you mentioned a free event we do called Dentistry from Our Hearts.
Yes.
It's a huge event. And we open up the office one time a year, not every week, one time a year. It's okay. I wish I could.
Yeah.
But one time a year, the community, and people come from all over the place, and we see hundreds of people. We diagnose more high blood pressure in that day than any dental disease. And we've had patients that we send right to the hospital because they're candidates for heart attacks right there. So, there's been an old saying for many, many years, the mouth is the window of the body. That we can diagnose cancers, we can diagnose ailments in the mouth. We can see blockages on a panoramic x-ray that goes around the head. We can see carotid arteries that are blocked. And when we see those type of things, we refer people on to their physician. And it's a very gratifying thing. And I know we're going to talk about some other things that we have planned to talk about, but we just don't fix teeth. We save lives on a regular basis in our office. And that's a really good feeling.
Do you find that you've had to do additional training and studying to be able to recognize some of these things? Because like you said, you go to a doctor, you tell him you have a toothache, he fixes your tooth, and you go home. But he really doesn't look around at other things.
Obviously, we're not doing full body exams, things of that nature when patients come in. but you have to stay on top of it. You know, dentistry is required every 2 years to renew our licenses. We have to do continuing education. And a lot of the different things, I know you told me we want to talk about sleep apnea and some of the links between some of the dental diseases and some of the very serious things that can kill you. So we're constantly staying on top of it. I think it's imperative when a dentist does his continuing education to go out and take courses and do things that's going to help spread your umbrella, spread your tentacles, if you will, so you're able to really cover a lot more territory than just drilling and filling and billing. And we find that, and all of our doctors do it. We go back, we take courses, we share the information with each other. We're constantly meeting with our doctors and going over things in terms of things that we need to look out for, oral cancer screenings and things like that. And a lot of the equipment that we use when people come into our office, they'll get oral cancer screenings. Back in the day, it just used to be a visual. Now we have all kinds of equipment where we can screen the patients. Even a simple blood pressure can tell us a lot of different things going on with patients. We are constantly doing training. And we all, dentists have to, every 2 years, get recertified in CPR.
Well, you know, it's so coincidental because when we spoke about coming on, this was a few weeks ago, and we talked about the health relationship. Just yesterday, and it doesn't matter who it is, I took somebody to elderly, he's in his mid-80s, to a pulmonologist because he's having some oxygen problems and whatever. Some of the questions he asked had nothing to do with the lungs, nothing to do with the heart. It was about sleep. Does he have sleep apnea? Does he have any teeth problems? Does he grind his teeth at night? Does he have this tooth? Does he have that problem? It was mostly about what's going on because this kind of stuff, sleep apnea, he said, is one of the biggest causes of pulmonary problems that people have.
So we can talk about sleep apnea for a minute. So
we can.
A lot of people know they have sleep apnea. One of the telltale signs with sleep apnea, I mean, there's a couple symptoms you look for. First of all, snores, that's one symptom that is a possible sign of obstructive sleep apnea. Being overweight, lots of times having difficulty breathing is another issue when it comes to sleep apnea. Being tired in the middle of the day. When we do a screening, and we do a screening for every patient that's walking through the doors now with sleep apnea. And the sleep apnea screening asks you a series of questions, and it may not seem like it's an issue, but we all know people who sit down in a chair in the middle of the day or they're watching television early in the evening and they're out. And why are they out? Because they're getting terrible sleep through the night. So what sleep apnea is basically you're stopping breathing throughout the night many, many, many times. And it's a disturbed sleep. You don't get that good, deep, what we know as REM sleep through the night. And when you don't get that REM sleep, your body's not regenerating as it needs to during those sleep hours. And with disturbed sleep throughout the night, that's where you can start having respiratory issues, pulmonary issues, all sorts of things, which leads to hypertension, stroke, all these terrible diseases that you hear about are all related to apnea. Most people separate the mouth when it comes to their general health. They think of it differently than any other part of their body. You know, they think of it almost like a commodity, where we'll say to people, hey, you know, you really have to come in and get that crown taken care of. Yeah, you know what? I'm going on vacation. Let me see how I'm doing financially when I get back. Or we're redoing the kitchen. I don't want to really do any reconstruction work on my mouth. I'd rather do it in my kitchen. And dentists just hit themselves in the head and go, am I hearing this right? You don't want to take care of the health of your mouth. You want to fix your kitchen, or you want to go to Europe. And usually it's the people who have the most amount of money that are usually giving us these type of answers. And they don't stop and think, if this was any other part of your body, if I said, Bob, it's going to cost you $10,000. You, God forbid, might lose your leg. I don't care where you're at in your life. You're going to find that money.
Do you think, and I'll speak for myself, and I'm sure I'm not much different. If you said to me, I go for cleaning, and you say, you know, you need a crown. I don't see it. I don't feel it. So I have no idea. If you have a knee ache, you know you need something done with your knee. So the question to the person probably is, do I really need that crown? And I imagine that's got to be the toughest. If you go to an orthopedic, because you have a torn meniscus, you're going to fix it because you can't walk. When a doctor says you need a crown or whatever that might be, or oral surgery, whatever, and you're not feeling anything, how do you convince them? That's the thing.
Phenomenal point, but that's what makes it a little more frustrating from the dentist perspective.
I'm sure.
So we go to great pains. When you come in our office, we show you the crack on your tooth. We'll take a picture, we'll do a scan, we'll show you the
But
crack.
that's after it hit me with a chisel.
No.
Anyway.
We do it before.
You do. No, you
And
do.
we show
You do.
patients where their cavities are. We show people where their stuff is so the patients can understand it. Lots of times people will see that. They still treat the mouth differently than the rest of your body until, like you say, lots of times they'll wait till they have pain. I mean, we'll tell people, crown this tooth now before you fracture the tooth. And if you fracture the tooth, what happens is you need to have an extraction, you need to have an implant. It's a very involved procedure, costs a lot of money, a lot more money. And dentists are the leaders in medicine when it comes to preventative treatment, okay? We tell you to take care of your teeth. We clean your teeth so you don't get gum disease. We tell you to fill your fillings so you don't need crowns. Why do people need crowns? Because they let things go too long and the filling turns into a crown, or a root canal in a crown. And why do people need implants? Because a crown is fractured off, it's decayed out underneath. So everything kind of goes through this cycle that if you really stay on top of your oral health, you can prevent a lot of the work that a lot of people here have.
To that point, you're right, because one of the few things you can do preventatively for your health is the teeth. You can't prevent a broken foot. You can't prevent a heart attack. I mean, you can obviously eat better, whatever. Teeth you can maintain to the point where you can prolong a lot of these issues.
We could almost end this broadcast right now because you have proven to me that you actually listen to me. Okay, because I preach this to you and I preach this to my patient.
Yeah.
This is the only part of your body that you can control the health on.
Correct.
But if you say, I want to have a healthy mouth, I'm going to go regularly, I'm going to take care of the problems, I'm going to fix the problems. Like you said, unfortunately, things happen.
Yeah.
You know, we all know people who have had heart attacks or strokes or brain tumors or things. They lots of times can't prevent that. They look like they're the picture of health. And unfortunately, their number comes up and they can't do anything about it. If a patient decides I want to take care of my mouth, they will take care of their mouth. And oftentimes when you take care of your mouth, think about it. If you have all your teeth in your mouth, by the way, the studies have shown there's a direct link between life expectancy if you have all your teeth in your mouth. That it says something about your overall health. If you're missing a tooth or two in your mouth, it affects your life expectancy. But if you take care of your mouth, you're eating well, your physical appearance is better, so it's helping you when it comes to presenting yourself publicly and smiling. If you have beautiful teeth, you're gonna smile. If you have teeth that are not looking so good, you're gonna, maybe not smile. People are gonna think you're not the nicest person in the world, okay? I smile all day long, okay? I wanna be happy. I wanna exude that to people. And people who do that, it's a good feeling in life because people smile back at you. But people who don't take care of themselves, I mean, we've fixed patient smiles. We'll say, give us a big smile, and we'll get a very half smile. And no, a big smile. And it's very sad. They'll look at you and go, I never smile, or I forgot how to smile because I'm embarrassed for what I have.
Embarrassed, yeah. Somebody has an infection in their mouth. How does it translate to getting to the brain or getting to the heart condition or get through the bloodstream? What are the normal results from it? Because you obviously see this.
We've seen 2 major cases in about the last year and a half in our office. And lots of times it's from delaying treatment. So if patients need to have a root canal, or they need to have a tooth taken out and an infection sets in. It's localized at first, but then it can get into the bloodstream. You get what's called sepsis. And we've had, of those 2 patients, one had an emergency. We had to call a rescue squad in the office, bring the patient to Aventura Hospital, thank God close by, but about 5 days in ICU till they got the infection under control. We have another patient who went to the islands, and this is a very interesting one because this is another big problem in dentistry, is they thought they were saving money. So they went and had a root canal done in the islands, and it wasn't done effectively. And the patient got an infection, the infection set in. By the time they got to us, we sent them to Aventura Hospital immediately from the office before they were an emergency. We sent them over there, went on IV antibiotics, and the patient to this day has permanent numbness in their lower jaw, some damage to what we call the TMJ, the temporomandibular joint, and we'll have some arthritis issues down the road. And
But he's alive.
they both, thank God.
I was going to say,
Have
neither
lived.
one of them would have lived.
Well, we were having a different conversation.
Yeah.
And thank God, both patients are alive and well today. But you can die from this. In our dental journals, we see regularly something will pop up in a dental office or a result of something, and it's usually a patient failing to get dental treatment. So people have to take this as serious as they take any other part of their body. If you went to a cardiologist and you said you have a blockage in your mouth, in your heart rather, and you need to have a procedure done immediately, you're going to do it immediately. You're not going to say, let me think about it. I'm going to go away on vacation, or I'm applying for a mortgage, you're going to do it immediately. Same thing goes with the mouth. If you hear you have a problem and your dentist shows you the problem and you trust your dentist, do the work.
I think that's the magic word, trust your dentist. You work in a community. You're a member of a temple. You live the life of your patients. So you see them at dinners, you see them at cocktail parties, you see them in your home, and then you see them in the chair. So I think you have overcome a lot of that trust issue that normally might have been there. But so many times you go to a dentist or a doctor, you barely know them unless you have to go to for that purpose. And if their bedside manner is lousy, or they are abrupt, or they're not friendly, or they don't really take that time, you're going to walk out of there and probably say, he just wanted to make a few dollars by selling me something.
I'm in a position in my life I can look a patient right in the eye and say, if you don't do this treatment, it's not going to affect my lifestyle, but it's going to affect you. So you have to trust your dentist, just like you trust your auto mechanic. It could be a blind item, but that's why we go to great lengths. We will show people fractures in their teeth. Let's talk about a different area related to this also, which expands. So I do a lot of Invisalign. I hope you don't mind me saying.
Not at all.
You're one of my patients that changed your appearance with Invisalign to a level where you actually saved money down the road because you had all kinds of plans to do all kinds of other things. But Invisalign alone, you're a good looking guy. You called me cute, but you are a good representative of
I'll be the first spokesman for Invisalign.
Okay. But a lot of people think of it as a cosmetic procedure only, and it's not. Because when we take teeth that are, really crowded together or in trauma with each other where we're seeing cracks in the teeth, that's like having your tires out of alignment. It's the same analogy. You go to the mechanic or the tire place and they tell you, hey, your tires are out of alignment. You're not going to say, let me think about it. You're going to say, can you do it today? Because I don't want to drive on misaligned tires. Same thing with your teeth. And we see people who have misaligned teeth. Some of them are Williams Island. Many of them are Williams Island residents. And one in particular cracked their teeth all the way through, where it's going to require alignment of their teeth, extraction of their two front teeth, implants of their two front teeth, and major dental work that could have been prevented just by aligning their teeth properly. These are things that can be avoided, and this is how you keep your mouth healthy. I mean, you got to prevent gum disease and cavities, and the alignment of your teeth is huge. And those three things are the key so you can hold onto your teeth the rest of your life. And preventing periodontal disease, when your teeth are all crunched up there, your hygienist is going to spend half of the appointment or more cleaning these lower anterior teeth when you go in there. Well, gum disease, we now know because of that inflammation, that same plaque that builds up on your teeth builds up on your arteries and veins. And it's linked to heart attack, stroke, diabetes, pancreatic cancer, rheumatoid arthritis, in women, early term birth, and in men, even erectile dysfunction, because you're blocking the flow of blood. And when you're blocking the flow of blood, it leads to a lot of bad things.
But how do you educate people to this? Because we're sitting here now and people are going to listen to this and thousands of people will hear this and maybe 10% will believe it, some won't, maybe some will. If two do something about it, it's a home run. But normally you get them in there. They come in for a tooth cleaning. Then you'll come in, check them out. You'll say, you have this, and this. And they'll say, well, they'll say, I'll think about it, and they leave.
But
isn't it frustrating?
You've been in there where, it can be frustrating, but we go to great pains between our hygienist and myself to educate the patients. And we do it every time. Some people don't want to listen, but we do
that's
it
what I'm saying.
Every single time. Yeah, but that's life.
That is.
That's life. You tell people, stay away from this, don't do drugs, don't do all these. And look how many people are addicted to drugs or have alcohol issues that they wish they could avoid, but if they would have done certain things, they could have avoided it. If one person walks in my office and says, I saw you on Williams Island TV with Bob Shelley, that was amazing what you said. That is worth your time and my time and this crew's time that's filming this, because we changed one person's life. And maybe we saved a life. Maybe we kept somebody living longer. And you told me, you said, I want you to come on and talk about health. I want you to talk about the health, the relation of the mouth to the rest of the body. And that's the most important message we can send. So yeah, it can be a little frustrating, but sometimes you got to kiss some frogs so you find your
it's interesting because we have AMR. I don't know if you know who they are, but AMR is a medical service. And we're the only community in South Florida, the only one that has them full-time on property, on site. And I would say in the course of a year, we do about 3,000 and 4,000 calls, which is enormous. Now, they're not all life safety, but I would say over just this year alone, I know for a fact we've saved 5 lives. Now, it's a fortune of money to have this on site, but what value do you place on a life? And they're not here. It's like insurance. They're not here for the masses. They're here for the ones they save. And it's an insurance policy, but basically you're doing the same thing. If you get to one person, that's a winner. You've done a lot. You've taken dentistry to a different level. You've personalized it to the point where you really are not only doing somebody's dentistry, but you're also trying to get them to lead a healthier life through oral hygiene. Because there is the relationship to other areas, like you just read off 5 or 6 of them. I really believe that you live that life with it. You believe it. And we have tremendous amounts of people living here. And obviously we have dentists, we have doctors, cardiology, whatever it is, and some have been very successful. But I think medicine in general has changed. Education of medicine, the breakthroughs that there are today. So when I talk about you doing this, it is, you said, the mouth is the gateway to your body, so to speak. You are what you eat. But how does dental hygiene affect some of these things? Because I guess that's what we want to also talk a little about.
So back to dental hygiene. So think about this.
Yes.
So you mentioned my mother. I knew your mother too.
Yes, very much.
Okay.
She would take her hair off when she sat down.
I wasn't going to talk about that. I wasn't going to talk about that.
It's a very cute story. My mother lost her hair. God bless her. She was only 94 when she'd go to you. And she'd sit in the chair and she'd take her wig off, put it on the thing. And the first time the doctor saw this, he got hysterical laughing.
Like a hat. She took it off,
Yep.
put it on the counter.
And that says a lot about you.
I swear I saw it move a couple times, but that's a whole different story. But so you think about your mom's generation.
Yep.
Okay. Your mom's generation, it was so common to lose your teeth.
Correct.
It was almost like a natural thing.
Yes.
There was even a saying in the quote unquote old days in my mom's time, it was a little younger than your mom. My mom's time was for every child born a tooth lost. It was like an accepted thing because
Well, I want to interrupt because I'll tell you a funny story. We have a lot of women here that are looking for men, and a lot of men are looking for women. It's normal. And the joke of it is if they can drive and they have teeth, they're available.
okay. And if they don't, they can come to me.
That's right. There you go.
I can We might even give driving lessons
There
soon.
you go.
Okay. But that was the accepted, you live, you die. You live, you use your teeth, you get false teeth, and that's how you live your end of your life. And that's virtually gone these days. I can go 6 months where I don't even make a partial denture for a patient because that's not where we're at anymore with implants, myotic innovations.
Look how
and
it's
things.
changed.
Change. It's unbelievable. I mean, people keep their teeth. Now, somebody asked me a question the other day. They said, dentistry is very expensive. What happens if you don't have insurance, and what happens if you can't afford it? That's unfortunate. That's kind of why we do our 1 day of free dentistry. There's places people can go to maintain, but a lot of people don't have a high dental IQ. It's not meant as an insult, but because they don't have it, most people can afford a toothbrush and toothpaste and floss if they choose to take care of their teeth. People don't take care of their teeth, bad things are going to happen. If you go take care of your teeth and have good hygiene at home and go to a professional and get your teeth clean, that's more than half the battle right there. Diet's a different issue. I mean, if we were all great in shape and ate perfectly, hey, maybe there would be less sugar in our diets and less cavities, but that's not the big problem. The big problem is really gum disease. And cavities we fix. You just have to go regularly and get it
So
done.
what do you do for gum disease? How do you prevent that?
So it starts with prevention, okay, going first. Going to your hygienist no more than every 6 months. That's super important. I would say at least a third to maybe a third to half of our patients go every 3 or 4 months because they require it. They build up a lot of plaque or they're not regular flossers and they really have to stay on top of it. So the hygienist is the first thing they need to do. If things get worse and progress, we have a great periodontist in our office, Dr. Matt Fine, who's been with us for many, many years. Matt, there's been so many innovations in periodontal treatment. It used to be the old days of gum
But is it
surgery.
brushing, flossing, spraying?
Flossing, mouthwash, watching your diet, drinking a lot of water, super important. Water's amazing in terms of if you can't get to a toothbrush, if you're having lunch at the pool at Williams Island, you don't have
Drink a
your
glass
toothbrush
of water.
with you, rinse out your mouth with a glass of water afterwards. But even the periodontal treatments, gum surgeries, when I first started over 30 years ago, gum surgeries were brutal. Now we do a lot of things with lasers. And even the grafting procedures have gotten way, way better than they used to be before. So we have a lot of treatments to keep people's mouths healthy. And the flip is when we're done at the end of the day, your mother's denture times, those have been replaced by implants. Sometimes it could be a single tooth implant. Sometimes it could be a full mouth reconstruction of patients with implants. And we can give people life again in a very short period of time with implants in the office. And we have all that's under one roof. That's, one of the things Miles Cutler did was he was an innovator in the practice of dentistry because he brought all the specialties in under one roof, and we continue to have that.
But that's
to this
what you
day.
do.
That's what we do. I mean, we have 6-month-old babies to, I saw a man about 3 weeks ago, 103 years old. Came in, they walked in the office, amazing.
I want to be that guy.
I want to be that guy.
I want to be that guy too.
I want to be that guy too.
Well, you know, what we do here on the island, we're very big on health. We have the health center, we have a therapist, we have a complete therapy department, which is licensed. So people come with their ailments, whatever it is, they have prescriptions. But a lot of this is vitamin therapy, a lot of it is health. And it has amazed me how it has grown. We are now getting ready to redo our entire spa. And probably 40% of it, in fact, we're going to be talking about later, is health and fitness and preventative. But because Williams Island has changed the demographics, we have about 5,000 people that live here. The average age might have been 60 10 years ago. We have 400 and some odd children on the island now, which we never had before.
Great.
So we are revamping the whole amenity package of the island, because that's what's there. The reason I bring it up is because what we've tried to do is have a lecture series on health. And like what we're doing now is great, but we also have these lectures where we get 150, 200 people come to these lectures.
That's great.
And it's about what you, and I would love you to do one, but we have chiropractors, we have therapists. So it's so much involved. To me, what you're talking about, it's important because anything you can do to prevent a death or an illness is so critical. In your field, it's one of the few things in health you can take control of your own life. You can't control your heart yourself. You can't control your legs yourself, because these are things that the body wears out after a while. But what you do can change that.
Look, everybody wants to look good, okay? Lots of times patients will tell us, oh, aesthetics isn't important to me. Aesthetics is important to everybody, more important to some than others. And a lot of what we do is aesthetics too. But it's not a facade. We want to give a patient health and aesthetics at the same time. And lots of times we'll have patients come in and say, I'd like you to veneer my teeth. And we'll say, okay, but we'd like to get your bite right first, so you have a healthy bite, you're able to keep everything clean, and this dentistry lasts you a long time. It used to be an aesthetic procedure. But what we've learned over time is the restorations and what you have in your mouth, your fillings, your crowns, people have implants, they last longer when your teeth are aligned better, when your bite's better. Your own teeth will last longer when your bite's better. And these are those things you talk about preventative. People take it for granted. They think it's just purely aesthetics. And you reach a certain age of your life. You know, you said the average age of the resident at Williams Island is about 60.
Now it's about 50.
Okay.
Yeah, it's dropped drastically.
Well, I find 50, in my opinion, is the age where health takes over.
Yes.
And you want to look at longevity, and you want to look at your kids and watch them grow up and be successful and have grandkids. We evolve as we get older. We certainly don't do it the same way we did when we were 18-year-old boys, thank God. Okay. But health takes over. And 50, I find that age where most people, it starts clicking in. And we see that with our patients too. You know, we'll talk to people we have generations. Our practice has been around. I was a patient in our practice since I was 8 years old. That practice has been there over 50 years. And we have patients come in, and you'll see how they evolve, where eventually it'll be like, you know something, I've been thinking about this now. Now I do want to align my teeth because I don't want to lose them. I get it.
So on that thought, just because I don't want to forget what I want to ask you, what is the difference, if any, between Invisalign, which I know you're very, very involved with, and and I can speak for myself, and normal orthodontist? Because I know the traditionalist will never agree with the Invisalign and vice versa.
Initially, when Invisalign came out, a lot of orthodontists poo-pooed because general dentists were doing it.
Explain a little what Invisalign is, because some people may not realize it.
A series of clear aligners that allows almost all orthodontic movements, almost everything that you can do with braces today you can do with Invisalign. Invisalign's gotten much, much better over time. They've had several generations of material. They've spent over $1 billion in R&D, research and development, to develop a very specific aligner. And it's not what you do at your self-dentistry. That is not what we're talking about. We're talking specifically Invisalign. That is the king of clear aligners. So it's more comfortable than traditional orthodontics. It's more aesthetic than traditional orthodontics. You take it off to eat. It's more hygienic because braces, it's hard to floss. You have to use a floss threader. Almost nobody does that. And it's pretty quick. Most of our Invisalign cases are done in 6 months. The only patients that we push towards orthodontics, and we have an orthodontist in our practice too, is patients that tell you, I know me, I just won't wear it. So we don't want you to waste your money.
Oh, I see what they won't wear the.
But every other
But
case,
it's like wearing a retainer.
it's like wearing a retainer. So you know it's easy to do.
It's nothing. Literally nothing.
It's literally nothing. But a lot of people just have a thing and they know they're not disciplined. And we don't want them to go into Invisalign because we know it's going to be frustrating for them, frustrating for us. We do spectacular cases, things that people never dreamed about that they could do with Invisalign 20 years ago. We do on a daily basis in our office today.
So basically, they're doing the same thing.
Same thing. It's kind of, one's like riding a bike, the other one's like driving
And
a
from a
car.
cost standpoint, is there that much difference? Well,
Hundreds of dollars. That's it. Not much.
yeah, I was going to say.
Just a few dollars.
But there's time difference, isn't there?
We find Invisalign to be much faster. As long as the patients wear it as they should, it's very predictable.
And at what age can they start wearing Invisalign?
There's
Orthodontist starts young.
Believe it or not, they have a product called Invisalign First that my orthodontist does in our office where kids are wearing it when they're 7 and 8 years old.
Really?
Yeah. And we've done patients, by the way, in their 80s with Invisalign. I'd say I've had at least a dozen patients, I would say, in their 80s who want to hold on to their teeth. They're in good shape. Everything's good about them. And it just hits them.
I mean, they don't say who cares anymore at 80 or...
No, they're staying fit. They're exercising. They're taking care of themselves.
Everything has an end date, so to speak. A tooth is only going to last just so long, unfortunately. The days of living to 90 are around today. 20 years ago, they weren't. What do you do to, I mean, you want to keep your teeth.
So, I hate to disagree with you, even though we're not on the Temple board together anymore.
Victor, listen.
I'll disagree with the statement, everything has a lifespan. That's not true.
Okay, that's what I'm asking you.
Okay, so if you have a tooth that doesn't have a big restoration, it doesn't have a big cavity in it, and you prevent cavities in your mouth, you watch your diet, you have fluoride, and has become a big political football.
I know.
And without getting into politics, I'm just going to give it to everybody very straight. Fluoride is amazing. It's endorsed by the American Dental Association. It's endorsed by the American Pediatric Dental Association. It's become a political football, and the only people who are opposing fluoride are politicians. You will rarely find a dentist who's going to say anything bad about it. It is one of the greatest innovations, health innovations of this century. They have communities that have fluoride in them, that the cavities are cut in half versus the communities that don't have fluoride in them. So it's super, super important. So if you have teeth that don't have big cavities in them, teeth are aligned properly, good hygiene, there's no reason you don't hold on to your teeth the rest of your life. We don't put in big silver fillings. We do bonded restorations, nice white fillings now. It's less traumatic for the teeth than the big silver restorations were when you and I were growing up. And there's no reason people can't hold on to their teeth from the day they're born and they
Wonderful.
get their adult teeth. There's absolutely no reasons. There's going to be generations that will require very little dental work as long as they take care of it.
Well, is there anything else you want to add to all this? Because this has been great. And I know you have to go back to work. I know
Got to go back to work. So I would just say, treat your mouth as good as you do any other part of your body. Don't cut this out and treat it like a commodity. Know how important it is to your overall health. Trust your dentist. If you don't trust your dentist, find a dentist that you can trust. Ask questions when you're at the dentist. If a dentist tells you need to have a crown or a root canal, ask them why. If a dentist shows you cracks in your teeth and tells you need to align your teeth, don't wait till it's too late. Don't wait till you fracture off a tooth. We started an Invisalign case yesterday on a guy who fractured off his front tooth. He waited too long. And now he has to do Invisalign. Then he's going to need implants and all kinds of expensive dental work. So treat this. You will live longer. You will have a healthier lifestyle, a healthier body, because it all starts here. And that's what people can't forget.
Well, I want you to come back to do one of our lectures here.
I'd love it.
And I want to thank you so much. Really,
Thank you.
You and I go back a long time, and we've been talking about this, and I think this is great. And I appreciate if you're listening, please listen, take his advice, not mine, but I can speak for myself. I've been to his chair, I've been to his office for God knows how many years. And what he says is the truth.
The Dental Care Group's a good destination for out in tour too. It's no Williams
You're right down
Island.
the street.
It's no Williams Island, but we're getting there.
It's getting there. It's getting there. We'll be right back. Thank you. And I want to thank you all for watching us today. I hope you've enjoyed the show. And we look forward to seeing you next month. Have a great week and a great Thanksgiving. Thank you.